Hello, this is Eitan Shalom at the Body Mind Wellness Center in San Diego, and I'm here with my patient who has tightness in her thoracic spine here, and I've needled the rhomboid. So she was able to identify very specifically where the tightness and stiffness is, and she linked it to what she feels in her low back as well. And so on palpation, I have found the trigger points in the rhomboids, which I'm deactivating with these needles, and also the paraspinal muscles. And these are very fine needles. These are the needles that I use on children. And this is an example of adjusting the needles to the individual patient. She's a long-time patient. She's fine-boned and delicate. And though she's an athlete, she also knows that she prefers delicate needling and she responds well to it. I wouldn't use these needles on myself. I would use the big needles because I'm a big lug of a guy and I want the stronger stimulation. But what's interesting is she gets the same trigger point release with these little needles as I would get from larger needles. And here I've done the motor point of the upper trapezius on both sides. And I'm doing those points because they're acupuncture points, Jianjing, gallbladder 21, and those points release and relax the pelvis. So she was able to identify tightness in her low back, and when I asked also the sacrum, so here are the sacroiliac, this is the sacroiliac joint on the left, sacroiliac joint on the right, and those are quite tender with palpation. And then I've done some paravertebral muscles in the low back, and this is a point in the L5S1 ligament, but that one was not, I wasn't able to really get much of a insertion on that because it was too strong for her. And then I'm doing the gluteus medius and minimus on the right and left, and she's got some chronic calf issues because she's a professional dancer, and so I have done some calf muscle releases of trigger points and motor points. And that's it. Thanks for tuning in.